Good evening, ladies and gentlemen. My name is Eric Workman, and tonight I want to try to talk to you about a disease called dementia. This is not a easy disease to have by any means. Right now, 47.5 million people worldwide have this disease. You may ask yourself, what is dementia? It's the deterioration in memory, thinking, behavior, and the loss of the ability to perform normal functions that we take for granted every day. So why am I talking to you about dementia? Because I believe that it is safer and more practical for dementia patients to be in a healthcare facility than they are to be in their own home or a family member's home. Dementia patients require 24-hour-a-day attention. According to senior medical editor of care.com, his name is Kenneth Robbins, he's quoted as saying it is important that they are in a safe place in which they have care when they need it, 24 hours a day, and where they can continue to be active both physically and mentally. Also, there is a medical term called sundown. Dementia patients are given their medication during the day, usually once or twice a day, and that's when it basically works the best, is in the daytime. However, once the sun goes down, the memory loss and confusion hits the hardest, and that's where the term sundown comes in. So once that happens, they can walk out the door, be completely confused of where they're at, and wander off. Now, say if it's in a family member's home, and that would happen without the family member knowing, who knows what could happen. The patient's going to get lost and not remember their way back or where they're actually at. In a care facility, they have 24-hour nursing staff, and most places have security officers as well that watch cameras. So if they would happen to wander outside, they can be brought back in safely. One of the biggest things is the stress on the caregiver. Dementia patients need, again, 24-hour-a-day care, 24-hour attention, and that could be a lot on a caregiver, in a family home. Here's a statistic: 3/4 of all family member caregivers work a full-time job outside of the house. So we all have stressful jobs. The 9 to 5 that, whatever the case may be, most of us have stressful jobs. And then to come home and to a family member that's wandered off, that doesn't remember where they're at, that's added stress that really isn't needed whenever you have care facilities out there that can take care of your loved one professionally and medically. According to carepartnersmobile.com, a majority of the caregivers say that caring for a dementia patient also it takes a toll on their performance at their current job. So that's something else to look into. Is it, how much does it affect you at your current position if you're watching them in your house? You want the best for your family, but you can't put yourself in a place to where it's going to cost you to lose your job. These next two slides you'll see give you some facts about dementia and some facts about being a caregiver for somebody with dementia. I've done an interview with an LPN that works with dementia patients, and I asked her the critical question: what do you feel is better, healthcare facility or being in a family member's home? And her response was, in a medical facility. And I asked her why. She said, there's so much attention that a dementia patient needs that it's very easy for a family member to get stressed, get overwhelmed, and possibly cause harm to the dementia patient even though they don't want to. So there's a lot of things we need to take into effect with this, that it is actually better for you to put your family member in a care facility rather than at home. Most times insurances do help out, you know. So if it's a money thing, there's ways around that. In conclusion, from the World Health Organization, dementia has a physical, social, and economical impact on families, caregivers, and society. You know, it's hard enough to know that your family member may not remember who you are. At least let's give them the chance to be in a place to where people know how to take care of them, how to treat them, how to talk to them, and how to keep them safe. That's the main point. Let's keep them safe.